Good morning, guys. A dreary morning here in Solihull. Thought I'd do a really quick video on results cases. And the question I get asked a lot at our course is, when is the right time to give someone results? Now, this might be blood test results, an x-ray result, a scan result, ultrasound scan. I'm always asked, is it right to give the result at the beginning of the consultation, or is it right to give it after data gathering, after asking some questions? Or the other common question that I get asked is it right just to say to the patient, in a role play scenario, what would you prefer if I give the results first or if I ask some questions first? Now, I want to give you a few thoughts on this, having done these types of role plays for many years for people preparing for CSA exams, PLAB 2 exams, GP Stage 3 exams, and others as well. So the first, let's tackle a bit of when do we give the results, beginning or after doing some questions. Now, the first thing to say, look, there is no right or wrong with this. Every patient, every consultation, every role play is unique. And you have to play off things like gut instinct and what you think is right. I've done a huge video on results cases on YouTube. So if you want to go into more depth, then watch that video. But in essence, I would say if I get an opportunity to ask my questions first and do my data gathering, I'm going to take that opportunity, because if I understand a bit more about what's going on in the story, if I have got things a little bit clear in my mind about what the situation is all about, when I give those results, then inevitably questions are going to come. What does this mean, or what happens next? I'm in a much better position to be able to answer those questions. If I've just jumped in and started giving results straight away at the beginning, I might give those results. I might give some blood test examples. So your blood results are actually normal. Oh, so what does that mean, doctor? And what happens next? And are there further tests? And why have I got this? And I don't know the answer to these things because I haven't asked any questions. So if I'm not getting any pressure, this is a big if there is no pressure from the role player pushing for results, I'm going to take the opportunity and do my data gathering first. Psychosocial red flags, all the other things that we talk about on our courses and our other videos. However, this is not a gold set rule. This is not that you must always, therefore, get your questions out, because you're going to be getting some scenarios where people are anxious, people are nervous, there are cues of annoyance coming when you start to ask a few questions. Oh, they're looking for the results, they're saying, I've been through this all before, doctor, and those are cues. You cannot afford to miss these cues, of course, so you adapt. You just say, look, and normally we tend to ask a couple of questions first, but I can see this is really worrying for you. Let's go for the results straight away. Or, gosh, normally we ask a couple of questions first, but I can see you've been through all this. I can see you're a little bit frustrated by the whole thing. Let's go straight for the results. Now, that's fine. That's a cue you've picked up on, and you've adapted yourself, and you've not just ignored the cue, you've dealt with it, you've gone with it, you've worked with it. However, if there is no cue from somebody else telling me that I should go and give these results earlier than I anticipate, then I'm going to take that opportunity, understand the story, understand the situation first, and then when I'm ready, when I've got an idea in my mind, then I'm going to go and give those results, because those results have a lot more context and I'm able to answer the inevitable questions that follow. So number one, do not think there's a golden rule that manages or that is said the same for all cases. But if someone gives me the opportunity to ask questions first, I'm going to ask my questions first, because I can understand the situation better and then probably do a much more shared, patient-centered, informed management plan. Now, the other question that I get asked is, well, isn't it right just to say to the patient, in a role play scenario, what would you prefer? Would you prefer that I give you the results at the beginning, or would you prefer I ask you questions first? Now, I see the point of doing this, like, to get patients involved and understand what is right for them. The only problem with this in a medical exam role play is this is a very leading question. It's very difficult to get anything but one answer there. When you say to somebody, so what would you prefer? Would you prefer, I've got the results here right now. Would you prefer that I go through them now, or would you prefer I ask you a few questions? It's very rare that someone's going to say, I'm okay, doctor. I'm happy to wait. You do your questions. Because it's a leading question. They're probably going to go, oh, yeah, what were the results? And then you're drawn in. And remember, this might have been a situation where you weren't going to be drawn in. The person was quite happy for you to ask lots of questions to understand the situation. But because a leading question was asked, it's kind of inevitable that they're going to say, well, if you got the results, let's go for the results. So I tend to avoid that question. I think it just doesn't do the job that we think it's trying to do. And I think we end up getting drawn into results actually when we could have taken a bit of opportunity to understand a bit more about that situation. And remember, giving results is one thing, but you need context. Context is so much more important than the number, the blood test result, the urea level, the creatinine level, the full blood, the hemoglobin, the result of the x-ray. You need context, because without context, you can't explain results properly. And remember, it is inevitable, whether results are normal or abnormal, there are going to be follow-on questions. And I want to understand the situation better myself, so I can serve that second half a little bit better and make it a more shared, patient-centered management plan. Much longer video where we talk about results cases in more detail on YouTube. Have a look at it, just search Arora results, you'll find it, I'm sure. But if you're watching this on Facebook, YouTube, Instagram, LinkedIn, or any of the platforms, have a look at the other ones, because we have lots of other videos that talk about consultation skills, communication skills, and we get people ready for PLAB 2, GP Stage 3, and MRC GP CSA, as well as other exams as well. Have a look at the website. If you are taking one of these exams, please do book on one of our courses, CSA, GP Stage 3, or PLAB 2, because we cover all this type of stuff and loads of other things that commonly get asked to me. I remember I've been doing this now for a while, and there's not many questions that you can ask me that I haven't been asked many times before. And the whole aim of what we do is try and simplify things. Like with results cases, don't go in with a golden rule, but if you get a chance, do some questions first. If the cues are there, drop in and give those results, because it's a cue and you can't ignore it. And maybe think about avoiding that question, what do you prefer, results first or me asking a few questions? Hope this has been of value to you. Website auroramedicaleducation.co.uk. You know the hashtag, CAN PASS, will pass, hashtag I went with Arora. Have a great day.